Measles is a disease that many once thought had been eliminated from the United States. For decades, widespread vaccination programs kept outbreaks at bay, making it a rare sight for medical professionals. However, a concerning trend has emerged in recent years. Vaccination rates are declining, and with that decline comes the return of measles. Now, Texas is facing its worst outbreak in years, with over 100 confirmed cases, and tragically, the first measles-related death in the U.S. in a decade. Health officials are scrambling to contain the spread, warning that measles is one of the most contagious diseases known to humanity. This outbreak serves as a sobering reminder of the importance of immunization, especially as cases continue to rise. The resurgence of this preventable disease raises urgent concerns about public health and the consequences of declining vaccination rates. The Texas measles outbreak, how it started. The current outbreak in Texas began in late January 2025 when 2 measles cases were diagnosed in Harris County. Initially, health officials hoped to contain the spread, but within weeks, the number of infections climbed rapidly. As of late February, at least 124 cases have been confirmed, with the outbreak spreading beyond Texas into neighboring New Mexico. Gaines County, a rural area in western Texas, has become the epicenter of the outbreak, with 80 reported cases. The virus has since spread to several nearby counties, alarming health officials who fear that the numbers will continue to rise. Given the highly contagious nature of measles, containment has proven difficult. Most of the cases have been identified in children and teenagers between the ages of 5 and 17, with 62 reported infections in that age group. Younger children, ages 4 and under, account for another 39 cases. These numbers highlight the vulnerability of unvaccinated individuals as measles spreads easily among those without immunity. According to the Texas Department of State Health Services, DSHS, nearly all of the cases in this outbreak involve individuals who are either unvaccinated or whose vaccination status is unknown. Health officials stress that this outbreak is preventable, as the measles, mumps, rubella (MMR) vaccine has been proven to be 97% effective with 2 doses. The virus is suspected to have spread into New Mexico, where 9 cases have been confirmed in Lee County. Of those cases, 4 are in children, emphasizing that the outbreak is not confined to Texas alone. The tragic consequence, the first measles death in a decade. On February 26, 2025, an unvaccinated school-aged child in Lubbock, Texas, died after contracting measles. The child had been hospitalized the previous week and tested positive for the virus. This marks the first measles-related fatality in the U.S. in a decade. Medical professionals are devastated by the loss, emphasizing that measles is a preventable disease. Dr. John Brownstein, an epidemiologist, described the situation as tragic but not unexpected, given the scale of the outbreak. He warned that more cases and potentially more fatalities could occur if vaccination rates do not improve. Dr. Laura Johnson, a pediatrician and chief medical officer at Covenant Children's and Covenant Health, expressed shock at the outbreak. Having practiced medicine for nearly 2 decades, she never anticipated dealing with a measles crisis in the U.S. She recalled seeing only 1 travel-related measles case while in medical school, back when the disease was considered eradicated in the country. So far, at least 18 people have been hospitalized due to severe complications from the virus. Many of these cases involve children experiencing breathing difficulties linked to pneumonia. Fortunately, there have been no reported cases of encephalitis, a dangerous inflammation of the brain that can result from measles. Dr. Ari Brown, a pediatrician in Austin and spokesperson for the American Academy of Pediatrics, has been inundated with calls from concerned parents asking if their children can receive the MMR vaccine ahead of schedule. She stressed that measles is an extremely serious illness, describing how the symptoms can leave children severely ill. The role of vaccination in preventing measles. The Centers for Disease Control and Prevention, CDC, has long recommended that children receive 2 doses of the MMR vaccine, one between 12 to 15 months old, and the second between 4 to 6 years old. A single dose is 93% effective, while 2 doses offer 97% protection. Despite the vaccine's effectiveness, immunization rates in the U.S. have been declining in recent years. The CDC reported that only 93% of kindergartners received routine childhood vaccines, including MMR, for the 2022-23 school year. This is a drop from 94% in the previous year and 95% before the COVID-19 pandemic. The consequences of lower vaccination rates are now becoming apparent. Measles was officially declared eliminated from the U.S. in 2000 thanks to widespread immunization efforts. However, experts now fear that the country is losing its ability to keep the virus at bay. Misinformation about vaccines has played a significant role in the decline of immunization rates. A discredited study linking the MMR vaccine to autism continues to circulate online, despite overwhelming scientific evidence proving otherwise. Pediatricians and health experts warn that such misinformation puts lives at risk. The global rise of measles cases. The measles outbreak in Texas is not an isolated event. Across the world, cases of the virus have been rising at an alarming rate. The World Health Organization, WHO, estimates that 10.3 million people were infected with measles in 2023, with 107,500 deaths, most of them young children. Several countries, including the United Kingdom, India, Indonesia, and Russia, have seen significant increases in measles cases. In Britain, 2,911 cases were reported in 2024, the highest number in over a decade. The Democratic Republic of the Congo recorded over 311,500 cases in the same year. Experts attribute the rise in cases to falling immunization rates. The COVID-19 pandemic disrupted routine vaccination programs worldwide, leaving millions of children unprotected. In 2019, the global childhood immunization rate was 86%. By 2023, that number had dropped to 83%. To combat the resurgence of measles, the WHO and other global health organizations have launched renewed efforts to boost vaccination campaigns. The Immunization Agenda 2021 to 2030 initiative aims to eliminate measles in affected regions by increasing vaccine accessibility. The highly contagious nature of measles. Measles is one of the most infectious diseases known to humankind. The virus can linger in the air for hours after an infected person coughs or sneezes. According to the CDC, if one person has measles, up to 90% of unvaccinated individuals exposed to that person will also become infected. Symptoms begin with a high fever, cough, runny nose, and red, watery eyes. Within a few days, a characteristic rash spreads across the body. The virus weakens the immune system, making patients vulnerable to complications like pneumonia, encephalitis, and even death. Given how easily measles spreads, health officials stress the urgency of vaccination. The current outbreak in Texas highlights how quickly an isolated case can become a full-blown public health crisis. Measles complications, more than just a rash. While many people associate measles with its signature red rash, the virus is far more dangerous than it appears. Measles can lead to severe and sometimes life-threatening complications, particularly in young children, pregnant women, and individuals with weakened immune systems. The most common complications include pneumonia, which is the leading cause of measles-related deaths in children, and encephalitis, a dangerous swelling of the brain that can cause permanent damage. In some cases, measles can trigger a condition known as subacute sclerosing panencephalitis, SSPE, a rare but fatal brain disorder that can develop years after an initial measles infection. SSPE leads to progressive neurological deterioration, with symptoms ranging from memory loss and behavioral changes to seizures and coma. Since there is no cure, preventing measles through vaccination is the only way to eliminate this devastating risk. Pregnant women who contract measles face additional dangers, including an increased likelihood of miscarriage, premature birth, and low birth weight in newborns. These risks underscore the importance of widespread immunity, as protecting the community through vaccination also safeguards those who are most vulnerable. Beyond the immediate symptoms and complications, measles has a long-term effect on the immune system. Research shows that the virus can cause immune amnesia, wiping out immune cells that had previously built resistance to other diseases. This leaves infected individuals more susceptible to infections like pneumonia and diarrhea for months or even years after they recover from measles. This aspect of the disease makes vaccination even more critical, as it prevents not only measles itself, but also the secondary infections that can follow. Why measles is making a comeback. Despite the availability of a safe and highly effective vaccine, measles cases are rising worldwide. The reasons for this resurgence are complex, but experts point to declining vaccination rates as the primary driver. Vaccine hesitancy, fueled by misinformation and distrust in medical institutions, has led to lower immunization rates in many parts of the world. In the U.S., vaccination coverage among kindergartners has dropped below the 95% threshold needed for herd immunity, creating an environment where measles can spread. One of the most persistent sources of vaccine hesitancy is misinformation surrounding the MMR vaccine. In the late 1990s, a fraudulent study falsely linked the vaccine to autism, leading to widespread fear among parents. Though the study was debunked and retracted, its impact continues to influence public opinion decades later. Social media has further amplified anti-vaccine narratives, making it easier for misinformation to spread and harder for public health officials to counter false claims. Additionally, the COVID-19 pandemic disrupted routine childhood vaccination schedules, leaving many children unprotected against measles. Lockdowns, overwhelmed healthcare systems, and concerns about visiting medical facilities during the pandemic resulted in millions of missed vaccine doses worldwide. Now, as societies return to normal, these immunity gaps are becoming evident in the form of new outbreaks. Internationally, some regions face barriers to vaccine access due to conflict, poverty, and weak healthcare infrastructure. Countries experiencing political instability or economic crises often struggle to maintain vaccination programs, leading to periodic surges in measles cases. To reverse this trend, health experts emphasize the need for stronger public health campaigns, improved vaccine access, and policies that encourage immunization. Many countries are implementing stricter school entry requirements to ensure children receive their vaccines before attending class. Additionally, healthcare providers are working to rebuild trust by addressing vaccine concerns and providing clear, science-based information to hesitant parents. The current outbreak in Texas is a stark reminder that measles has not disappeared and will continue to resurface in communities where vaccination rates decline. Without collective efforts to increase immunization, measles will remain a threat, undoing decades of progress in disease elimination. Now it's time to hear from you. Were you surprised by the scale of this measles outbreak? What do you think can be done to prevent future outbreaks? Let us know in the comments below.